Welcome to Dr.Bone, B1, YouTube channel.
Topic: How to use shoulder simulator through posterior portal by Dr. C. Siva Narasimha Reddy.
Today I'm going to show you the diagnostic arthroscopy of shoulder. How to do a diagnostic arthroscopic scopy in a shoulder model. So we have a shoulder model here, and we should know how to use a scope, and we have to find out all the structures in the shoulder joint step by step. So we have all 15 structures to see, which we have to see in the diagnostic arthroscopy. So from the posterior portal, we'll identify biceps tendon, posterior labrum, inferior axillary recess, glenoid articular surface, rotator cuff insertion, bare area of humeral head, articular surface of humeral head, rotator interval, anterior-inferior labrum, anterior axillary recess. And when we are seeing from the anterior-superior portal, we will find posterior glenoid labrum and posterior rotator cuff insertion, and anterior-inferior glenoid labrum, subscapularis tendon and subscapularis recess, and biceps tendon. So now the scope. So this is how we have to hold the scope. So we should not touch the other areas. So this is a 30 degrees inclined. So whenever you want to see down, this light source should be in perpendicular, and this is how you have to hold. Whenever you want to see on the right side, you have to put the light source on the left side, okay, and vice versa. So now I am going to see the shoulder joint from the posterior portal. So now I have introduced the scope into the shoulder joint, and now I am going to explain you all the structures. So this is, now I have introduced from the posterior portal, and can you see that? Can you see the glenoid, and you can also see the labrum, okay. So and you can see this, the dark brown structure, which is subscapularis, which is on the anterior aspect. And can you see this, the other one, light brown structure? Now that is our biceps tendon. And can you see this, a fenestration or a hole? That area we can see our rotator interval. Rotator interval is the area between our supraspinatus and our subscapularis. Now if you want to see the roof, then you have to change the light source, and you can see the humerus, and you can also see the articular surface of the humerus, and you can also see the bare area. And if you want to see the axillary recess, inferior axillary recess, then that is our inferior axillary recess. And so we got all our, and we have to see our rotatory cuff insertion. Rotatory cuff insertion. So can you see that rotatory cuff insertion, that white structure? That is our rotatory cuff insertion. Okay, so I hope you got all the points from the posterior portal.
Thanks for watching the video.